The content of this podcast is for informational purposes only and should not be considered medical advice. Always consult with a qualified healthcare professional for any health concerns. Take care of yourself out there.
Welcome to Unravelling. This is a podcast that sees the world through the lens of mental health. I'm Mary Wilson, a journalist.
And I'm Kurt White, a social worker and psychotherapist.
And we want to let you know that this episode is going to be all about suicide. We're continuing our discussion for Suicide Prevention Month.
Yeah, in the last episode, we talked to Kirk Woodring, a social worker and clinician who's spent a lot of his life thinking about suicide. As a clinician who's worked on crisis teams, worked in very acute settings like inpatient work, has worked with a lot of individuals thinking about suicide, and who himself had a close family member who died by suicide. And we really explored a lot of the dynamics of that at the individual level. You know, what is it like for a person when they're thinking about suicide? How typical is that? Quite typical, actually. How could we talk about it? How can we make more room for people to talk and think about this issue? But in a way, that's only sort of one level of analysis of things, right? Because when suicide happens, of course it happens in an individual system, in a family system, but it also happens in a whole community environment, doesn't it?
Those larger external social factors. And to learn more about that, Kurt, I went out and spoke with a sociologist who has done research on this. Her name's Anna Mueller, and she recently completed a 3-year-long study on a specific community that had been seeing what they call suicide clusters among its youth.
Yes, these suicide clusters, when they happen, they're really hard to understand, and not a lot of people have studied them in a way that I think really feels satisfying for those communities. You know, how can we really understand this pattern? How could we even interrupt it in an ongoing pattern where suicide continues to happen at a higher rate in a community, right? And really that's not a question for clinicians so much. So I'm interested to hear about this idea of sociology. What is sociology as a discipline for folks that don't know?
Yeah, sociology is really the study of human interaction and those larger social interactions that happen when we're part of a community.
Yeah, and there's a long history of it in sociology. Emil Durkheim wrote a book called Suicide. He was sort of one of the founding fathers, so to speak, of the discipline of sociology, maybe the founding father. And so it was considered right there from the beginning. But then actually a lot of modern research in sociology has not really tackled this issue of suicide or suicide clusters until really quite recently. And that's where I think Dr. Mueller's research and her colleagues' work in this is really especially interesting.
That's right. And she actually published a book. It just came out this year. It's called Life Under Pressure, The Social Roots of Youth Suicide and What to Do About Them. Anna Mueller is a sociologist, an associate professor at Indiana University, and a leading expert on youth suicide and prevention. She speaks with school districts, policymakers, and community groups about strategies to improve their youth suicide prevention and postvention efforts.
It sounds like she's the perfect person to talk to about exactly this question. Let's have a listen now.
Anna Mueller, thank you so much for joining us on Unravelling.
I'm so happy to be here. Thanks for having me.
Oh, we're so excited to hear from you. And let's start right in with your recent field work on youth suicide, which brought you to the peaceful, quiet town of Poplar Grove. Tell us what brought you to that community that seemingly was very idyllic and had no glaring issues.
Yeah, well, actually, the people from Poplar Grove, some of the public health folks reached out to me because they were actually struggling with a pretty serious youth suicide problem that had been going on for over 10 years and that had included a series of suicide clusters that you can imagine were pretty distressing for the community. And they really wanted to figure out what they could do differently to sort of change the story of life for kids in their community. So they invited me out to come meet them. And I decided to say yes, probably one of the best decisions of my career. And through those conversations, I realized that it was a really surprising place, in part because it was so idyllic. there was so much social support, there was so much connectedness, there were so many resources. And yet, despite all of these positive, wonderful things that we would think would protect kids from suicide, they were actually having this terrible problem that they were struggling to change the story of.
And explain some of those suicide clusters that were happening. That's really what drew you to the area.
Yes. I have always been someone for like the past more than a decade. I've been working specifically on youth suicide clusters and trying to understand what exactly it is when we say the social contagion of suicide. Like, what is that? Because research has really struggled to unpack why social contagion of suicide happens, which is all that I mean when I say the social contagion of suicide is that when a youth has been exposed to the suicide attempt or death of a friend or family member, on average, not always, but on average, they experience an increased vulnerability to thinking about suicide. And among some kids, it's rarer actually attempting suicide. And so I wanted to understand the mechanisms driving that relationship so that we could figure out how to disrupt them.
So often the way that suicide is talked about is that it's sort of an individual issue, but that's not what you found. You're looking at the social causes of suicide, the external world. Can you tell us what you mean by that?
Yeah, that's a great question and really gets at like the heart of the work that I've been doing for over a decade with schools and communities. If suicide was just caused by individual sort of internal things like a mental illness or a person's individual experience, that would be one thing. But suicide clusters kind of confound that, right? Because it's a place that is being impacted by this disproportionately high rate of youth suicides. So what that means is, of course, we don't eschew the individual personal factors that contribute to someone's suicide risk, but it's also important to consider all the other reasons why people in this community may be disproportionately vulnerable to experiencing psychological pain and may be surprisingly unwilling to ask for help and other things that might sort of help us activate those protective factors that can help disrupt that transition from psychological pain to suicidal thoughts, attempts, or even deaths. And so that's what we call sort of the social roots of suicide. And basically what we found in this community was that looking at the local environment that was surrounding kids in their daily lives was really critical to understanding why so many kids in this community were suffering pretty significant emotional distress and why they and their families were really unwilling to seek help for that pain and suffering. And collectively, that environment then sort of had a kind of unique contribution to the collective risk of suicide for kids and families in that community.
You talked to so many kids and families in your research there in Poplar Grove, and so many of the kids who struggled with this were the grade A students, top of their class. They were on the varsity sports AP classes. But you realized that from the outside, maybe they looked like they were doing well, but on the inside, they were really struggling.
Yeah, absolutely. As a society, we often have like our sort of stereotypical idea of like what kind of kid might be vulnerable to suicide. And that was alive. Those sort of myths about who might be vulnerable to suicide was very present in Poplar Grove as well. Like we think about kids who are getting in trouble, who may be abusing drugs and alcohol, who may not be popular, they may be loners or not have any friends. And one of the really challenging things in Poplar Grove was just like that just did not fit the majority of kids who were dying by suicide. As you said, many of them were the like seemingly perfect kids who had it all, who were, popular class leaders, had seemingly had a bright future ahead of them. But secretly, many of them were suffering, sometimes with mental illnesses and sometimes just under the intense pressure, or of course, a combination of the two.
Mm. And when these suicides happened, in your investigations, you found out that some of these mourning rituals actually were causing a bit of a contagion effect. Can you tell me about some of the things that were happening after someone died by suicide that what's actually triggering more suicides?
Yeah, we call it suicide postvention. Those are the activities and things that we do to try to support a community to like limit the pain and suffering that kids are experiencing, connect them to the care they might need, and so on and so forth. And a lot of postvention is a form of suicide prevention, because one of the things we're doing when we engage in suicide postvention is trying to prevent additional suicide deaths from happening. Unfortunately, postvention can be really complicated. We don't have a lot of great research on evidence-based suicide prevention. And then also it's so complicated, all the unique things that schools go through after a suicide loss. But unfortunately, there were some real pitfalls that were happening. One being that the school and community leaders were often trying to shut down conversations about suicide at the very moment when kids needed to talk about what was happening to them and what was like a defining part of their adolescent years. And that refusal to talk about suicide, it was actually because teachers and school crisis responders and counselors and mental health professionals were actually afraid that talking about suicide was actually going to cause suicide contagion. And that is actually categorically not true. It's actually the reverse. When we don't talk about suicide, when kids need us to share this knowledge with them, that's what generates risk, right? And so that shutting down of conversations basically pushed the conversation underground. Kids were just making sense of suicide on their own, and they don't always come up with correct information about, what causes suicide. I remember there was this one young teenager that I met, and she shared with me that she was just really terrified that kids could just snap one day and die by suicide. Because that's what she had seen her perfect, popular, amazing peers do. They looked like they had it all, and then they were just gone. And, I was one of the first adults to ever explain to her that that's not really how suicide works, and that you actually have a lot of opportunities to intervene and take charge of your own well-being if you identify that you are starting to suffer, or you're worried that you yourself might snap. And then combined with that, the one place where suicide was getting a lot of attention was at funerals and other memorial services. So, but because people didn't really want to talk about mental illness, and they saw mental illness as shameful, which of course is something fairly widespread in the United States. We call it mental health stigma that can make it hard to talk about. So what that meant at these memorial services was that there was just a wild outpouring of love and affection and attention to the youth who had died, which is, of course, so important to surround families with love and kids with love when they have lost someone to suicide. But there was this sort of dark side to that, which is this inadvertent messaging that suicide was a way to get a lot of attention in death when the kids couldn't get that attention and love and support in life.
Yeah. So what help do young people need after a suicide of a peer, and how can these memorials be helpful to others who might be considering suicide?
Yeah. Well, one of the most, for me, personally powerful things that we ended up finding in this community was that when kids witnessed the grief of other people, so particularly the grief of the parents who had lost their child to suicide, that was incredibly protective and actually could almost what we call inoculate kids against suicide. So, and it's also interesting because it wasn't experiencing their own grief. Their own grief, for some kids, that increased their empathy and their identification with suicide as an option. But for kids who witnessed the grief of parents, it made suicide so real to them. They could just really see how much it hurts those who are left behind. And we had a group of kids who really told us, you know what, I was suicidal in my past, but after losing my best friend to suicide, I could never do that to my mother. I could never do that to my family or my friends or so on and so forth. So, and to make it even more, I think, powerful for me, you spend a lot of time in these communities when you're doing this research. So these people are very real to me. And there was this one family towards the end of my research. So I was already well known in the community, and the research was already well known. And they actually reached out to local public health experts to make sure that they honed their message. And at their daughter's memorial service, she unfortunately died by suicide. They made sure to emphasize that, she died by suicide. Help had been available. There was another option. And they really shared their grief and their sorrow. And they also role modeled how parents can be imperfect. And all of those things had such a powerful impact on the community. Like, we really saw people willing to be vulnerable about their mistakes, their own mental illnesses, as well as their daughters' psychological suffering. We did not see any suicide attempts after that loss, even though the funeral had a huge attendance. And that family has really continued to really do that work of like changing the conversation around mental health and suicide in the community.
Is there some pushback because suicide is so stigmatized when you're encouraging people to talk about this openly? Is there some hesitation to do that?
I mean, my only hesitation comes out of just a deep respect for people's grieving processes and how every family is a little bit different and has a little bit different of a story. So what I like to do is I think it's really important that we empower our faith communities, our local public health and suicide prevention workers with this understanding, so that ideally when families reach out for guidance, if they do, that at least the capacity is there, and then they can like pick somebody that they trust. I mean, I think our faith community leaders are actually so critically important, particularly around mourning rituals, to make sure they have this information and know what to do with it.
And getting back to some of those social roots of suicide, you talked about a culture of shame and the embarrassment that surrounds any small form of imperfection, especially in communities that, as you describe, have narrow cultural beliefs. Can you tell us what this means and how it puts those youth at greater risk of suicide?
Yeah, absolutely. So one thing we found was that, when everyone knows everyone in a small town, which is what Poplar Grove is, it's really easy to have a pretty narrow set of cultural beliefs that are broadly agreed upon. And in Poplar Grove, basically everyone shared a pretty clear idea about what a good kid was, and I'm using good in scare quotes, and a good family. And when people deviated from that, idea of perfection, it was immediately gossiped about, and a lot of very deeply personal information that I can understand that many people and families might prefer to keep private, because it's okay for us to have some things be private, right? Not secret, because we don't need to be ashamed of them, but we deserve to keep some of our medical information private and not just gossiped about throughout our community. So that gossip basically served to make, even the sort of, basically people witnessed what happened when people deviated from ideals and norms and expectations. And then it would get talked about everywhere. And so that created a lot of pressure on kids and families to appear perfect, even when perhaps on the inside, there might have been something that was quote unquote going a bit wrong. And also, let's be clear, most families and most adolescents go through periods where things are not all perfect, right? Like myself and my own family included. So this is a pretty high stakes game. And so that's what led to what we called this culture of shame, right? Which is basically, it was just way too easy for kids and families to feel ashamed in this environment for things that for many families are just a normal part of life, right? So many of us have what could be a diagnosed mental illness, or if not a diagnosable mental illness, just, serious emotional distress that we have to deal with, or anxiety, or so on and so forth.
Mm. When you left Poplar Grove after being really embedded in that community, did you feel optimistic and hopeful about that community's future, or were there still some glaring issues that you're hoping are addressed?
I do feel really hopeful for their future, in part because I actually still have a really deep relationship with the folks in Poplar Grove, and we've kept the conversation going ever since we ended our field work there. And that gives me hope. I go back probably every other year and share my latest research with them. And there's just such incredible passion and community involvement from the parents in the community, but also from school folks and trying to build that change. And I do think that when you can look to those change makers who are trying to take the knowledge and really change how the school works, change how the community works, I think that's a pretty beautiful thing and a real testament to Poplar Grove as a community.
So when you think about communities that are much different, very different from Poplar Grove, how might what you've learned apply in those situations?
I think, so actually, since finishing my work in Poplar Grove, I have worked in communities that have been hard hit by suicide clusters and that look very different from Poplar Grove. Some of them are more urban, and one of them is actually much more rural and also has much higher rates of parental incarceration, poverty, domestic violence, other really challenging, also just economic insecurity. I think the one commonality that we've seen across these spaces is that kids are growing up in an environment where, for some reason, their ability to imagine their future and imagine a future that's worth living is questioned, right? They don't have that faith in their future. And it can be because of economic insecurity. It can be because political instability and just the world seeming like it's on fire. I mean, Poplar Grove had very particular things that were sort of causing the the psychological pain in the kids and families. But I think this way of looking at the world and thinking about, what is causing kids pain in my community, and how can we address that, not just, through therapy or clinical interventions for that individual child, but how can we think about building a world that supports their psychosocial developmental needs? That perspective is going to be valuable no matter what community you come from. And of course, a corollary to that is that, what we did was we listened to kids, right? That's what we went to Poplar Grove to do. And we gained a lot of wisdom from listening to their voices. And, kids really are the experts in their lives and what's going on and what are the challenges that they're facing. So just listen to the kids. Finding ways to incorporate them into local suicide prevention efforts is gonna be really valuable. And I think that's something we really demonstrated in our book and can be sort of translated to communities across the United States.
Did you get a sense that those young people felt like they were being left out of the conversation, even though it directly impacted them?
Yes, absolutely. They did. Yeah. Unfortunately, because adults were really scared to talk about suicide, that meant that there weren't a lot of opportunities for kids to participate. And then also the opportunities that were not at the school. And so because kids' lives are so deeply intertwined with their school, not having those conversations or activities through school was really limiting. So I think it's really important that we also collaborate with our schools to make sure that they're doing the best they can at lifting up and responding to kids' voices, but also at enacting suicide prevention within the school building, which is actually what I've been working on since leaving Poplar Grove.
Oh, tell us more about that.
Yeah, I mean, I'm like, oh, that's a whole other episode. I'm like, stay tuned, next book. But I think the one-liner of it is that it takes everyone in a school building to prevent suicide, though not everyone plays the same role, of course. We don't expect our teachers to be as involved as our school counselors or school psychologists or social workers. But it is going to take everyone, and it's also going to take embedding suicide prevention and mental health promotion into every aspect of schooling so that we don't overwhelm our capacity, the capacity of our school staff members. So that's what's up for me. That's what's next for me. I've got my work cut out for me, but I love this work, and I love the communities that put their trust in me and my collaborators.
Well, thank you so much for the important work that you're continuing to do and for your book. It was really a pleasure having you on Unravelling.
Well, thank you so much for the opportunity to share. I really appreciate it.
And we thank Anna Mueller again for that really interesting conversation and her book as well. Joining me again is Kurt, and we both got a chance to read the book. And we started this episode with some questions from you, Kurt, about how these larger social causes play a role in suicide. Do you think you got some answers from all of that?
Oh, absolutely. It was a real joy to listen to that interview and to read her book. I mean, even though it's, of course, about a very serious and dark topic, but I think the joy for me comes from the idea that we're learning some new things about this issue that I think are really practical and really helpful. This kind of research that she and her team have been doing, where you immerse yourself for years in a community and do detailed qualitative interviews and explore quantitative data to paint a full picture of things. You know, they really go into how they did that in some detail in the book, is just so valuable. It's a way of learning about things that really we just don't have anything like that in the field of psychotherapy. So I'm just very grateful to her for this work and to you for bringing her to us in this way.
Yeah, as a clinician, how do you think you can integrate some of what we've learned about these social causes into your work with individuals?
I think there are a number of key takeaway points for me. One is thinking about when people don't experience a sense of belonging in a community that supports the fullness of who they are, including ways that they struggle and are imperfect as human beings, especially in young people, where you're just trying to figure yourself out and having complicated issues of figuring out where you fit in the world is just totally a normal developmental thing. But it comes with this intense vulnerability, and sometimes even in very loving, connected, and supportive communities, the perception that you're not able to fit in because of some way that you're different can be a real tremendous crisis for a person. And you see this even in this community of Poplar Grove, which has such loving and caring adults, but also a real intense standard that people often find themselves, young people often find themselves not living up to internally. And this sort of paradox of how, even though no one in the community would wish for any of these teens to want to hurt themselves, that sometimes the idea that they didn't measure up made it feel like they had no value at all as human beings. This idea of spoiled identity that comes out of sociology, that like you don't fit in, therefore you lose the thing that's most important to you, the community that you love, right? And that this can happen in situations like this, and it can happen in situations very different from this, like in the LGBTQIA community, for example.
So the root of it all is somehow creating these communities that would embrace all identities and all aspects of someone.
Yeah, I think so. I think a certain amount of real acceptance of people in all of their complexity, including when that complexity doesn't fit into the community's idea about who a good person is or what you're supposed to be doing or where you're supposed to belong. I was intrigued by Dr. Mueller's comments that she herself, growing up in a community with a lot of diversity, a lot of different ways of being in the world, was probably a protective thing, actually, in that community. And I don't know that that's always thought about in that way. You know, sometimes very tight-knit communities, maybe there's a downside to them in some ways. I think most people probably haven't thought very much about that. And I think her research really shows that even that kind of thing sometimes has a darker side.
Yeah. Well, if you would like to learn more, we definitely recommend picking up the book, which is called Life Under Pressure, The Social Roots of Youth Suicide and What to Do About Them. Right now, for Suicide Prevention Month, you can download one chapter of that book for free. All that information will be in our show notes.
I really do hope people get a chance to read this book. There's a wealth of information in it that I think can be tremendously helpful in terms of building safe, healthy, resilient communities, especially for young people. It's also very well written, and I think people will enjoy reading it as I did, and learning from these wonderful researchers and also the kindness of the community and letting them into their lives in this way. I also just want to say, if anyone out there is thinking of suicide, struggling with a mental health problem, or has a family member, loved one that is, please get help. It does help. People can access the National Suicide Lifeline just by calling or texting 988 from any phone. Also, there's plenty of other resources that we will put in the show notes that may help and be of some interest. Unravelling is brought to you by Brattleboro Retreat and is produced by Charts and Leisure.
Find us on social media by searching Brattleboro Retreat. Brattleboro Retreat is committed to exploring diverse perspectives on mental health. While we invite hosts and guests to share their insights, the views expressed are their own and do not necessarily reflect the policies or positions of the hospital or its staff.